Hi all of you awesome scuba divers out there, welcome to Scuba Diving Magazine, your favourite place for the latest scuba diving news and gear reviews. Today I'm delving into decompression sickness because it isn't always explained that well in some introductory courses, and what you should do for a diver and how to recognise some of the signs and symptoms of decompression illness and sickness, they're only taught in the rescue diver course. Only any diver can suffer from decompression sickness, and the more divers that are aware of what to do if they feel or see some signs or symptoms, then they can start treatment earlier. This video is sponsored by scuba.com, and whilst you're hopefully not watching this in an emergency situation, I'm going to cover all of the information, the important information, before I tell you about today's sponsor. Decompression sickness, or DCS, is also known as the bends. We don't really call it the bends anymore, but you do still hear people talking about the bends. It was named for the workers who first worked at pressurized depths. Afterwards, when they came back up, they would like bend over to help alleviate the pain. The bends, that's what they called it basically. But the more official term is decompression sickness. So DCS describes a variety of injuries that result from inadequate decompression following exposure to increased pressure. This can occur following completely uneventful dives within accepted no decompression limits, but it's more likely after dives that involve a rapid underwater ascent. DCS can also be prompted by ascending in an aeroplane or climbing up a mountain too soon after diving, because they adjust the cabin pressure and the pressure around you. When you climb up hills, it drops the further up you go, as well as other things like deep tissue massages and stuff like that, hot tubs as well, so avoid those. When there is a rapid decrease in surrounding pressure, nitrogen that's absorbed by the body at depth comes out of solution, creating little air bubbles in the bloodstream and or body tissues, which is just a bad thing. The human body doesn't like bubbles where there shouldn't be bubbles. For the explain it like I'm five, as you breathe gas underwater, because of the water pressure around you, you absorb more of that gas into you that you're breathing into your body tissues, like your muscles, your bones and your organs and things. That in itself isn't so bad, but when you come back up to the surface too fast and it doesn't have time to slowly work its way back out of the tissues, they can then form bubbles where there really shouldn't be bubbles in your body. They can block blood vessels and organs from functioning normally, and where the bubbles form in your body determine what kind of DCS you have. So it's important to know what the diver is feeling and where they're feeling it, so that medical professionals can better diagnose exactly what is wrong sooner. Other than diving conservatively and ascending slowly at the end of every dive, the best thing that we can do as divers to minimize the chances and negative effects of decompression sickness is to recognize the signs and symptoms of DCS. So if you ever see them out in the wild, you can start treatment as soon as possible. Symptoms are things that you yourself feel. Signs are something that you can see or measure on other divers. A lot of people get confused about signs or symptoms. That's the basic broad definition. Symptoms is something that you can feel. A sign is something that you can see. In this section, we're just starting off with symptoms. Symptoms of DCS can occur immediately after surfacing or anywhere up to 24 hours later. On average, a diver with DCS will experience symptoms between 15 minutes and 12 hours following a dive. It can be incredibly broad. Symptoms can also vary between divers, and they can be very mundane, which is why some divers don't immediately seek treatment. It's not like breaking a leg or getting a paper cut where it's really obvious what the problem is. Some of those symptoms can be very subtle. Unusual fatigue is a common symptom, and most divers just kind of chalk it up to being tired after the dive. And a lot of the time, that's all it is. Scuba diving can be tiring. However, unusual fatigue should not be ignored. If you feel any of these symptoms, start taking notes of time and severity so that you can track any differences and changes over time. Write small though, because if you complete all of the notes properly in full, you're going to need plenty of space, and I'll try and put a list of everything down in the description below so that you can like take note. Itchy skin is another symptom, usually of a subcutaneous emphysema, where the bubbles form just under your skin and can create an itchy sensation and maybe even a rash. Pain in the joints and or the muscles of the arms, legs or torso is a big one, and of course where the bends gets its name. Again, some divers chalk like shoulder, knee or even back pain to like carrying cylinders around or tweaking a muscle, when it could actually be something a bit more sinister. Dizziness and vertigo. If you start to feel a bit woozy, put anything that you're carrying down somewhere securely and try to lay down before you fall down. If you fall over whilst you're carrying something heavy, then you are going to hit the deck hard and you're just going to multiply your problems. So if you do feel a bit woozy, just put everything down, stabilize yourself so that, yeah, if you do fall over, you're not going to fall very far. Ringing in the ears is an unusual, like seemingly harmless symptom that should be monitored and noted. Some divers might just put it down to not equalizing properly on the dive, or maybe otitis externa, but it can actually be a symptom of decompression sickness, so take note of that. Numbness, tingling and paralysis. Paralysis is obviously something serious. If you can't move a certain body part, you need to jump to the diagnosis and treatment phase, along with numbness or tingling. If you feel anything a little bit weird, you need to take note of that. Shortness of breath is another very important symptom. If you feel like you can't get a full lungful, or you can't catch your breath even though you're not doing anything too strenuous, then you need to stop what you're doing and get help. If you feel one or many of these symptoms, you need to let other people know, and of course take notes and the time as well as the severity. It's always a good idea to get in contact with someone such as the Divers Alert Network and consult with them, but for more serious symptoms, contact local emergency services first to get them rolling, and then contact Dan. Signs that you can see on yourself or other divers include a blotchy rash. I mentioned that a little bit earlier with itchiness, but it's more of a sign technically than a symptom. Muscle weakness or paralysis. If you see someone struggling to do something that they normally wouldn't struggle with, it's worth asking them about it. The same with like staggering around. That could be caused by numbness or even vertigo. Mental confusion as well. Personality changes or bizarre behaviors also do need to be noted. Some DCS can affect a diver's behavior, and the diver themselves may not think that their behavior is weird, so it may be up to you to raise the red flags. Some more obvious signs of DCS can include difficulty urinating, coughing up bloody frothy sputum, and collapsing or unconsciousness. Now, I don't expect everyone to monitor one another when they go to the toilet after a dive, but it isn't something that should be ignored. But if you do feel the need, but you can't perform, you do need to pay attention to that. But if you see any of these signs, then start assessing them just in case. If a diver is exhibiting symptoms of DCS, emergency oxygen should be provided right away, as soon as possible. Most dive boats should have an emergency oxygen kit on board and have enough oxygen, a big enough O2 cylinder, to get the diver to emergency services so that they can then take over. Oxygen kits are quite simple, but training on how to use one properly is very important, and that is something that you'll learn on your rescue course or a first aid course that includes oxygen administration. If you don't have oxygen, then the highest nitrox mix you might have available is better than nothing. So if someone's diving on nitrox and you don't have oxygen, or your oxygen runs out, put them on the highest nitrox mix, and then they're still getting a higher than usual amount of oxygen. You basically want to get as much oxygen into them as possible. Next, determine the severity of their condition. Is it emergency, is it urgent, or is it timely, by following these guidelines. An emergency DCS is a diver who is profoundly dizzy, intermittently conscious, weak, walking with an abnormal gait, or having trouble breathing. Is experiencing a serious medical emergency. Administer 100% oxygen if available and arrange emergency evacuation to the nearest medical facility. Always contact emergency medical services first and then contact Dan. You basically want to get the ambulance rolling first and then contact Dan. Although a diver with severe DCS requires recompression, it is essential that he or she is stabilized at the nearest medical facility before transportation to a chamber. Urgent DCS is a diver who is experiencing severe pain that is either constant or increasing, should be placed again on 100% oxygen and given fluids. The next step is to contact Dan or the nearest medical facility. Emergency air transportation may not be necessary in all cases. Do not give the diver analgesics or pain relievers unless advised to do so by medical personnel, because they can mask further signs and symptoms. Timely DCS are symptoms are either not visible or have progressed very slowly for several days. The main signs or symptoms are vague complaints of pain or an abnormal sensation, which could indicate something other than DCS. Obtain the best diving history as you can and do a neurological evaluation. I'll talk about that in a second. Then go to the nearest medical facility for evaluation. After obtaining professional medical advice, a neurological exam should be conducted. Write down as much information as you can about the diver's recent diving activity, and a neurological exam can be done by absolutely anybody. You don't need medical experience or training, it's not required, but it is important to do the right steps and try to complete them all. Ask the diver about any diving activities within the past 48 hours, including the depths, the dive times, the ascent rates, surface intervals, breathing gas used, and any problems experienced during or after the dives, especially rapid ascents or missed stops. If you have the time and the diver is capable, perform as much of the Neuro Exam as possible, but do not let it interfere with evacuation to a medical treatment facility. Try to perform the following steps in order and record the time and results. If you have wet notes or a blank slate, it can be useful to write these down beforehand so that you can just fill out the answers should something occur, and you don't need to remember all of this because there's a fair amount here. So the first one is orientation. Does the diver know their own name and age? You just ask them, what's your full name and how old are you? Does the diver know the present location? Where are we, roughly? Does the diver know what time, day and year it is? Even though a diver may appear alert and responsive, the answers to these questions may reveal some confusion, so don't omit them. Always go through the steps one by one. Looking at their eyes, have the diver count the number of fingers you display using 2 or 3 different numbers. So hold up a few fingers and say, how many fingers do you see? And then try it again. Check each eye separately and then together. Have the diver identify a distant object. What's that on the horizon? If they can identify a windmill or whatever it is, then you're basically testing their eyes for their distance of vision. Tell the diver to hold their head still, or you can gently hold it still whilst placing your other hand about 50 centimeters in front of their face. Ask the diver to follow your hand. Now move your hand up and down and then side to side. The diver's eyes should follow your hand and they shouldn't jerk around to one side and return. Check that their pupils, the black part of their eyes, are equal in size as well. Moving on to their face, ask the diver to purse their lips. Look carefully to see that both sides of their face have the same expression. Ask the divers to grit their teeth. Feel the jaw muscles to confirm that they are contracted equally. Instruct the diver to close their eyes whilst you lightly touch your fingertips across their forehead and their face to be sure that sensation is present and the same everywhere. If they can't feel something, it might be numbness that they haven't noticed. Check their hearing. Their hearing can be evaluated by holding your hand about 60 centimeters from the diver's ear and then rubbing your thumb and fingers together. Check both ears, moving your hand closer until the diver hears it. Check several times and try to compare with your own hearing. Obviously, if the surroundings are very noisy, you've got boat motors and things going, then the test is very difficult to evaluate. Try to ask bystanders to be as quiet as possible and to turn off any unneeded machinery. But if the boat motor is getting you to emergency services, then you have to skip this test. The swallowing reflex, instruct the diver to swallow whilst you watch the Adam's apple on their throat just to be sure that it's moving up and down. Up to the tongue, instruct the diver to stick out their tongue. It should come out straight in the middle of the mouth without deviating to either side. Then we're on to muscle strength. Instruct the diver to shrug their shoulders whilst you bear down on them to observe for equal muscle strength on both sides. Check the diver's arms by bringing the elbows up with the shoulders, hands level with the arms and touching the chest. Instruct the diver to resist whilst you pull the arms away, push them back, up and down. They should resist you equally. The strength should be approximately equal in both arms in each direction. Some people do have a stronger right or left depending on which is their dominant hand, but it should be roughly equal. Check their leg strength by having the diver lay flat down, raise and lower the legs whilst you do the same as the arms. You resist the movement, so push it down, lift them up whilst they're trying to work against you. For sensory perception, check on both sides by touching lightly as you did on the face. Start at the top of the body and compare sides whilst moving downwards to cover the entire body. Check one side, check the other side. The diver's eyes, of course, should be closed during this procedure so they don't cheat. The diver should confirm the sensation in each area before you move on to another. So light touches, when they say, yes, I can feel that, then you can move on. If they don't say anything, then just move around a bit, try and find where that numb area is until they say, oh yeah, I feel that, and then you can continue on, but of course take note of that numbness. Balance and coordination. Obviously be prepared to protect the diver from injury whilst performing this test, and if you're on an uneven surface, then it is quite dangerous. So first have the diver walk heel to toe along a straight line whilst looking straight ahead. Have the diver walk both forwards and backwards for 10 feet or so. Note whether movements are smooth and if they can maintain balance without having to look down or hold onto something. Next, have the diver stand up with feet together, close their eyes and hold out their arms straight out in front with the palms upwards. The diver should be able to maintain balance if the platform is stable, obviously. Your arms should be like around them but not touching them, just in case they fall over. Be prepared to obviously catch the diver if they do start to fall in any direction. Check coordination by having the diver move an index finger back and forth rapidly between the diver's nose and your finger, which is held about 18 inches or about 50 centimeters from the diver's face. So just hold your finger out and just say, oh, just quickly touch your nose and then touch my finger, and they'll go backwards and forwards. The diver should be able to do this even if you move the finger to different positions. They'll be able to track it. Have the diver lay down. Instruct them to slide the heel of one foot down the shin of the other leg whilst keeping their eyes closed. The diver should be able to move their foot smoothly along the shin without jagged or side-to-side movements. Check these tests on both the right and the left sides and observe very carefully for any unusual clumsiness on either side. If time allows, the following additional information may aid medical professionals with a diagnosis and treatment. Symptom onset times and progression after the diver surfaced from their last dive. Was the pain a 10 that has since reduced, or has it steadily grown, or is it staying the same? We need to know the severity and any changes in severity. The same for numbness, itchiness and other symptoms. Is it expanding or is it contracting? A list of all first aid measures taken, including times and the method of oxygen delivery and their effect on the symptoms. Ask them every 10 minutes or so just to monitor any changes. A description of any joint or other musculoskeletal pain, including location, intensity, and any changes based on movement or weight-bearing maneuvers. Photos of any rashes with a description of their location can be very important because they can change over time, and medical professionals can better diagnose something that they can see along with its progression. If you have something to be used as a scale, like a ruler would be perfect, put it next to any rash so they can get a sense of size. Information about any traumatic injuries sustained before, during, or after the dive are also very important. Denial is arguably the worst symptom of DCS. Delayed treatment can lead to permanent injury and prolong or even prevent the diver's full recovery. Emergency oxygen can cause symptoms to temporarily improve, only to reappear later. It's no substitute for medical evaluation, and much like secondary drowning, the diver can appear to recover almost completely on oxygen, only to relapse later on when they're alone, so it's always important to get yourself checked out properly. Always contact someone like Dan or a medical professional with training in dive medicine in cases of suspected DCS, even if the symptoms and the signs appear to have resolved. Worst case, you've alleviated your fears that you may have had, and you've maybe wasted an afternoon. Best case, you're already in the right place for treatment and assessment if the symptoms reoccur. Decompression sickness is tough because the symptoms are pretty broad. There's no definitive correlation between signs and symptoms for different divers. Something that one diver experiences for a particular DCS may be different to what another diver feels. Something to also look out for, which is very similar to DCS, is arterial gas embolism, or AGE. It's not a decompression sickness, but it does come under the decompression illness umbrella. Signs and symptoms of age include dizziness, visual blurring, areas of decreased sensation, chest pain, disorientation, bloody froth from the mouth or nose, paralysis or weakness, convulsions, unconsciousness, cessation of breathing, and unfortunately death. So again, it overlaps a lot of those symptoms of DCS, but it's vital that you get them to emergency medical care as soon as possible. Hopefully you learned just how subtle some of the signs and symptoms of DCS can be, and that you can follow your dive computer perfectly on a normal, uneventful dive and still get hit with an undeserved DCS. But the key to the best outcome, though, is oxygen, calling for help as soon as possible, and taking notes to save time. And now for a quick word from our sponsor.
SCUBA.com is your one-stop shop to find all of the top scuba diving brands, from the classic big brands like Aqualung, Atomic, Cressy Mares, Scuba Pro, as well as new and exciting brands, as well as having their online dive store that offers free shipping and a pressure-free fit guarantee, where if your suit doesn't fit you quite right, then SCUBA.com will send you the next size and collect the wrong one free of charge. But yes, SCUBA.com is far more than just a website full of shiny new diving equipment. They also have two dive shops, one near Newport Beach in California and the other on West 17th Street in Manhattan. Here you can try on and buy diving equipment, and SCUBA.com also teaches scuba diving classes. They run guided scuba diving tours, they service diving equipment, and they have the Pacific Coast Dive Club if you want to join up and get some diving in. If you're in the market for some new scuba diving equipment, then head over to SCUBA.com. It's a really easy website to remember. It's literally SCUBA.com, or you can click on this link up here, or there's going to be the same one down in the description underneath this video. And that's it for today. Hopefully you'll never need to use any of this knowledge, but yeah, it's definitely worth, if you do have wet notes or something, take a couple pages, or don't take them out, but fill out a couple of pages for that Neuro Exam, and just have plenty of space to write down like times, severity, and symptoms and signs and everything. Write it all down so that when emergency professionals turn up, you can give them all of this information and they don't have to waste time working it out for themselves if you've just been like waiting around on a beach waiting for the ambulance to turn up. It just saves a lot of time. But anyway, thank you for watching, everybody, and of course, safe diving.